in medicine, the worst phrase that we can say is, but we've always done it this way. Why are we going to change it now? And no more is this fundamentally important than women's healthcare. The practice of tilting the pelvis during a speculum examination to improve the visualization of the cervix is a technique that's evolved over time. In fact, it stems from the wrong size speculum shared down from Marion Jane Sims. Sims, in his work in the mid-19th century, discovered that bent spoon-like equipment or instruments can be used to separate the vaginal walls to improve visualization of the cervix. And in fact, it's something that we still use today. So sometimes for the right patient and for the right reasons, the Sims speculum, which looks like this, is still used by us doctors as well. To further visualization, medical professionals like me who have handed down the same technique by our colleagues, because that's what we've been doing with women all along, we learned that tilting the pelvis helps bring the cervix into view. This is often achieved by getting the patient to put fists, both of them, under the back of the small of their back and help them sort of tilt their backwards, and therefore we can have a look. And this is particularly used if someone's known as having as a retroverted cervix. I've done a whole video on what an anteverted and a retroverted cervix is. This is still because actually what we want to do is look at the cervix, but we still don't have the right size or the equipment to use to make sure that we're looking at the cervix properly. And just to show you, we have different size speculums. So this is a bigger size speculum. We have a long speculum as well. I'm not going to take these out of the packaging because obviously these are equipment bits of that are quite expensive. And then also we have a teeny tiny small speculum as well. They do come in long, short, medium, thick size, smaller size. There is a whole variety of different speculums that a good stock trolley. So this is in my clinical room where I'm using my equipment to do my video. A good stock trolley should have all of them readily available. And I say this time and time again, we have deep-rooted misogyny in healthcare, meaning that women's pain and inadequate equipment is being used to silence their voices. And as healthcare professionals, we know no better. So we're teaching outdated techniques to each other, when actually it could be as simple as changing the size of the speculum and also talking and communicating with the patient all the time, and not as a practitioner getting frustrated when you can't visualize the cervix, because we know the equipment needs to be updated. And on that note, there are two incredible women who developed a new speculum design called the Lilium. Please check out my video on that. So to my healthcare colleagues who've all reached out, worried that they might be doing harm to their patients, and also worried that they're using the wrong techniques by putting their hands at the bottom of the back, and that's how they were taught. It's not you, it's how we are taught in healthcare. This is because it's embedded in misogyny in healthcare, and we need to question that technique and also learn from where that technique comes from, because it's poor visualization. And think about, as my colleague said in this letter, is to think about going with a smaller speculum. And to women and girls, please let's not stay silent about inadequate pain relief that we're given for gynecological procedures, whether that's actually being offered a good lubricant or a vaginal moisturizer when you're going for a smear. Yes, you are allowed to use that. And if you have vaginal atrophy or genitourinary syndrome of the menopause, make sure that you're using local vaginal estrogen and stop that 2 days before your procedure. And you can use a water just to dip that in with the speculum to make it a bit more comfortable. And even if you need to for your smear, put the speculum in yourself, and yes, ask for a smaller size. If you're going for a colposcopy, if you're going to have a coil insertion, you are entitled to pain relief. That could be given localized anesthetic at the neck of the womb, or a localized anesthetic spray such as lidocaine as well, and sometimes gels or lubricants, and anything that makes it comfortable to hold the speculum in is really important. And there's a small suction device that is being developed so that we can actually use that as an alternative to the teneculum that we use to hold the cervix in place. So we need to be getting those innovations into women's healthcare so that procedures can be done without pain, and not just offer women hand holding or breathing exercises, or make women feel that they are the problem, when actually it's the system, the equipment, the techniques that are passed down through healthcare professionals, and that very dangerous word, but we've always done it this way. Why change now? Well, we must change it because it's putting women off and it's causing a lot of pain, and I deal with that pain in my clinics. Anyway, I'm going to stop having my rant. Thank you.